updates in this regard, Mr. Rao. Right now, what in fact it needs to also address that what is the extent of the transmission, so that people back home or in the various nations should be prepared in setting up the protocols accordingly.
Most of these are respiratory viruses, all those you have listed. You have also mentioned the respiratory virus which affect mostly children, especially from that Taiwan report. These also do remember that it is now near 5 years since the corona pandemic, and all children below 5 would neither have been vaccinated nor may have exposed to these the coronaviruses. But these respiratory syncytial viruses and some of the other viruses are mostly affecting children, and who don't have the immunity yet for these kind of infections. And the best way, since Chinese New Year is coming, and some of these viruses may be spread from China to the rest of the world, and then we have our own local viruses which are showing up in every winter, we should take precautions against getting these infections by, these are airborne infections, so a mask will make a big difference. Secondly, usual hygienic precautions, like when we go around touching here and there, and we may pick up the virus from contaminated door handles and other public place objects. And then if we touch our nose, we may spread it by physical contact rather than by airborne contact. So these are the reasons why I also said, please avoid going to very crowded places during this season when flu is viruses are spreading like anything, and the season suits that, and which is the cold, dry kind of thing. Mask also helps by keeping things warm and moist, like I said earlier. So these are the usual precautions against all these. We may not be able to vaccinate everyone against every kind of virus. So the best thing is to prevent by avoiding both airborne and contact-wise infections.
Mr. Rao, as there are also reports which claim that these are the unverified videos of the hospitals being overwhelmed with the staff not being able to tackle. But the National Disease Control and Prevention Administration is planning to establish a procedure for the laboratories for the reports and for the disease control prevention to verify these cases. As the information that we are at this point of time quoting from the global media coverage that has reported on the same. But in the case where there is missing data in terms of understanding the extent, how do we prepare at best with our administration and the healthcare staff, also making people understand and preparing beforehand as to how this can be potentially very harmful, and in another way also could be overwhelming the staff here as well?
For that, we have to hope our administration would remember the lessons they learned from the previous pandemics, not only the COVID-19 pandemic, but the SARS pandemic and the previous respiratory-borne infection pandemics. And they will put measures in place before the Chinese New Year, which is going to come soon, and prevent these kind of viruses from spreading. And as I said, it is not only in China. There are viruses around in other parts of the world also, and these can also spread. And in this flu season, it may be better that our health authorities start taking measures now itself to prevent spread of these infections within the nation and internationally. And all ports of entry like airports and seaports, etc., and also in all crowded places like malls and other public functions, if they take preventive measures like checking for fever, the temperature like they were doing earlier, and also checking out those who have who are coughing and not using mask, etc., and creating public awareness like what you are doing. And as to get more information, all of you in the media can try and contact media persons in China, especially from the foreign media, who may be able to confirm what is going on. if hospitals are crowded, if these videos are true or not. This can be very, all of you will have foreign correspondents there. You can reach out to them and find out what's going on.
All right, in that case, Mr. Rao, thank you for giving us the preliminary understanding of what and how exactly it needs to be addressed and dealt with, as there are no confirmed reports. What we only have is, in fact, the unverified videos that are being circulated widely on social media. But it remains to be understood that, giving the credit to the coverage, there is a suspicion of this being overwhelmed and potentially being very harmful and threatening for authorities and healthcare system collectively in India. Thank you, sir, for speaking to us. Now it's time to shift our focus to other